guys, this is Dr. Shamima Sattaruna from the YouTube channel Doctor to Health. Today is April 10 and we are going to talk about anxiety. What kind of anxiety? Generalized anxiety disorder, panic disorder, obsessive compulsive disorder. Let's start about generalized anxiety disorder. First, thank you for joining me today. What is generalized anxiety disorder? Think about it as excessive, persistent anxiety disorder where everything is excessive, persistent, repeated over everyday things like going to school, going to work, cooking, anything that can cause anxiety, and it is happening over and over again. Sometimes it can impair your daily activities. This may cause some muscle strain, tension, headache, can cause irritability, anger. It can make you restless. It can cause poor sleep and ending in fatigue. So yes, those can happen with generalized anxiety disorder. It can be treated with antidepressant and also it can be treated with benzodiazepines. Those are the medication that can help, but always cognitive therapy is the best because if you can do it with cognitive therapy, why even go to medication? Medication has side effects, tolerance. Withdrawals too. It can even cause withdrawal seizure, especially with benzodiazepines. So we always want to keep medication at last. What about obsessive compulsive disorder? Think about somebody who's having a lot of anxiety that is making them obsessed about it and causing them to do some compulsive activity. For example, you used your curling iron or you used your iron to do ironing on your clothes, or you cooked on your stove and you left. You drove out on the street from your home and then you think, oh no, I don't think I turned it off. So you go back and you check it again, and now you're doing this over and over again. You're going down all the way to the stairs, and once you reach at the bottom you think, oh no, I have to check it again, and you go back up again. 15-20 minutes later you are still doing the same thing. Or for example, you have a parking lot, there's a bump in the parking lot, and every time you go over it, you're afraid you might have gone over an animal or someone. So you get down, you go over to the back and you check, and you keep repeating this over and over again. 15 minutes later, you never left the parking lot. So all these things are obsessive compulsive disorder. You may even think of germs, that there's germs everywhere. I need to wash and clean. And so you repeatedly wash and wash and wash, and you still feel you don't feel like you're clean enough. That's also a form of obsessive compulsive disorder. All these things can be treated with cognitive therapy. Always good with cognitive therapy. Start with that, and if that doesn't work, then go to medication. Study has shown that our brain are amazing thing. It has so much neuroplasticity. What does that mean? It is always growing, learning, growing, and regenerating. So it's adapting to everything it's exposed to. It was thought that previously only school-age children learn and they develop their brain, and after that it kind of stops. Not true. In England, a study showed that taxi drivers, when they take an exam, they have to memorize all the places in London, and then they give an exam after that. So an imaging was done before and after the test, and it showed changes on the MRI. So yes, brain activity and brain learning does not stop. It always regenerates, it adapts in everything you do. Guess what? Anxiety, depression, these are genetic, and it also is caused by environmental factors. And so we pass it on in our gene. But guess what? With our activity, we can actually turn off certain genes and turn on certain genes that are good for us, that can also resolve depression and anxiety. So if we practice good practice, we can overcome some of these obstacles. Also, do you know that I used to be afraid of talking in public? I can do up to 10, maybe 15, but my heart starts thumping, and when I think about it's 20 or 30 people, I'm like, oh my God, that's a lot of people. I have to talk in front of them. My voice starts trembling, and then I'm like, I start sweating, I start having palpitation, my voice just, I lose my voice, and all of a sudden I'm like, I don't think I can do this. No, no, no. I don't feel well. I can't breathe. I think my chest is hurting. Somebody call 911. My chest is hurting. Give me that. Somebody just gave me this bag. I'm gonna breathe into it. After a minute or two, I'm calming down. What did I just have? A panic attack. Yes, that also comes from anxiety. So we can overcome all this anxiety that kind of disables us in our life. Some people have so much anxiety, they don't even leave their home. They feel afraid. If you have a bad event that happened in your childhood, it can come back and kind of haunt you. So there are many ways we can overcome some of this anxiety. Let's go over a few ways. One, let's think about a different thought process. So for example, if you think you're afraid of the water, you had a drowning event, you choked sometime in your childhood, now you're afraid of water. So maybe you can think of it as, no, water is fun. I see all my friends having fun, so let me think about it. So maybe when there's a swimming pool party, you can watch from far, like 20 feet far, wherever you feel comfortable, and watch your friends having fun. Then take another 5 steps forward towards the pool, maybe another 5 steps the next day, and keep on coming. And then think of this, that okay, if I go to the shallow end, I cannot drown because I'm 5 feet plus, so there's no way I can drown. Even if that is not enough, you can put on all kind of floaters and say, okay, I'm lighter than the water, so I cannot drown. If that is not enough, you can even ask your friends to help. Then you can go to the edge of the pool and dangle your feet in the water. Next, you can go to the stairs and sit on one of the stairs, the first stair down, and keep on going down until you can get up and stand in water without feeling anxious. Same thing with a dog. If you're afraid that a dog might bite you, if you run, guess what? Your brain thinks, okay, phew, I just saved myself from the dog from biting me. So the brain might think, okay, I just helped you. So they might make that pathway in your brain stronger. And now your anxiety is increased. Every time you see a dog, you start getting more and more anxious and you run away. Instead, if you think, no, dogs are not harmful. Most dogs are friendly. They don't bite. They are mostly somebody's pet. So they're used to people. And they're not crazy, they're all treated, so they will not bite me. So think of it this way, change your thought process and look at that dog from far. Maybe at one point you can see them from outside a window. They're just sitting there. Okay, next day, maybe your friend can have him on a leash and you can maybe step into the door and watch the dog from far. And slowly you come next to it, and at one point you pat it. All these you can do very, very slowly, like baby steps. You can even keep a journal. Write down all the things that can cause anxiety, from big to small, and start with the smallest thing. And then try to overcome that anxiety. Try to think about it and accept it. Feel that anxiety. It is, tell yourself that it's okay to feel anxious. I can be okay with feeling anxious, and just think, I will do this. Even if it makes me anxious, or it can resolve it, or it can reduce it to even half or even a little bit. Baby steps is all I ask. Do that. 3, ask for support. 4, don't criticize yourself. Don't think of bad things about yourself. Don't be judgmental. Try to commend yourself for doing every little steps you do. Instead of thinking negative, think positive. If you think positive for everything you do, it's going to help you to achieve more and more every day. So think positive. Next, cognitive therapy. Same thing with any anxiety. You can do cognitive therapy. Remember what we said? 8 weeks of cognitive therapy. In depression patient, we saw new and bigger hippocampus. That's the place in the brain where you process thoughts. So in a depressed patient, if you do cognitive therapy for just 8 weeks, somebody's just listening to you, and you don't even use medication, it can help. So please ask for support, do cognitive therapy, ask your friends to help. And lastly, if nothing else works, do medication. Again, benzodiazepines, antidepressants, all will help with anxiety and depression. Today I even had a patient, he's a Greyhound bus driver. He told me he could not drive because he's so anxious, his hands are shaking, and he doesn't want to cause an accident. So I had to start him on an anxiolytic, and the first appointment he would have with a psychotherapist is going to be Monday. So I helped him out. We get a lot of patients who come on and they're talking 100 words per minute, and almost 5 to 10 minutes they don't let me say a single word. I can't get a word through their sentences. They are going that fast. And finally, when I get a chance, I tell them, I think you are anxious. They will give you 5-10 minutes of all their symptoms. Even after that, I'm not sure what's going on. So I have to ask them specific questions to come down to what is exactly going on and how I can help them. So if you see somebody who's very fidgety, they cannot sit still, they are always jumping from one subject to another, and they're irritable, they're fatigued, they're having a lot of body ache, they're not sleeping well, think about anxiety. Try to lend them a hand, help them out, give them some suggestions, and maybe that friend one day will come back and thank you for helping them out. Hope this was helpful for you. If you do like it, please subscribe and like. And if you don't like it, leave a comment why, so I don't do it again. All right? Very nice talking to you again. Thank you again for joining me. Until next time, take care. Bye-bye.